YouTube, and welcome back to my channel. In today's video, I'm going to discuss the 3 different types of renal replacement therapies. All right. Most nephrologists are going to want to initiate dialysis on patients when patients' kidney function gets to about 10% and they have some significant symptoms that the nephrologist can't normalize. Let's say potassium is high, blood pressure is completely high, they're unable to get the fluid off completely of the person's body. So they want 3 types of renal replacement therapies. The first type we have is in-center hemodialysis. With this type of treatment, patients travel to the facility 3 days a week, that's the normal prescription time, have their dialysis around 4+ hours. Then most patients will go home the same day. You can receive hemodialysis sessions in another location. Let's say you're traveling, so you're able to do that. So that's not an issue there. Okay. The biggest things with in-center is that you're on a specific schedule. Everything you need is at the dialysis center. They have healthcare nurses, technicians are doing all the work for you. All you have to do, well, not all you have to do, is go to the clinic at the right day and at the right time. Sometimes there is adjustments in the schedule for bad weather, if you have a doctor's appointment that you need your treatment rescheduled, if you're traveling, or what have you. Sometimes you may go when there's an issue with the water, and you may have to wait a few extra hours to start your treatment. So there's pros and cons to doing in-center, but mostly know that you go 3 days a week, someone takes care of you while you're there, then you travel home the same day. We have patients that drive themselves, patients take public transportation, what have you. There's a whole host of types of people that do in-center dialysis. The next type of modality option is home dialysis. With home dialysis, you actually have 2 options. You can do what they do in-center with the machine and your permanent access, and you can actually do that at home after you have been trained. Okay, notice I said you're going to be trained to do this. We have what's called home hemodialysis. They use similar machines that they use in-center, and there's another machine that you can choose from that they'll go over that with you. With home hemo, it is 1 extra day per week, but the time is a little shorter. So just know that home hemo is going to be 4+ days per week, depending on the prescription. You're going to have the machine at home. You'll have all the supplies that you need. You have been fully and completely trained. The home nursing staff make sure you know what you're doing before they leave you at home to do your own dialysis. Okay, so we got in-center hemodialysis, we have home hemodialysis, and also one thing to mention with home hemo is that some nephrologists require for you to have a partner physically there with you while you're on the machine, and some nephrology groups do not require that. So just know that that may be an issue where you will have to have someone to come in along while you're trained to be trained as a support person. Some do and some don't, okay? The next home dialysis option is peritoneal dialysis. Peritoneal is completely different than home hemodialysis because it does not have to take the blood out of your body to clean it. The dialysis is done inside of your body with the peritoneal cavity, which acts as a natural membrane. So there's sterile solution that you are going to place inside of your body by way of a peritoneal dialysis catheter. You're going to have your sessions, and they'll teach you how to do this. Peritoneal dialysis, the biggest difference in peritoneal versus hemo is that peritoneal is done every single day. You can either do it in the daytime or you can do it at night. You'll be trained how to do it. The nurses will teach you, they'll train you, they'll teach you to order supplies, they'll teach you everything that you need to do to be successful. Training for PD takes 2 usually 2 weeks or so. Training for home hemo can take up to 5 weeks or even longer. A lot of programs will train you as long as you need to be trained, but on average, most patients are about 2 weeks to do PD or 5 weeks to do home hemodialysis. Okay? Modality choice is renal transplantation. With renal transplantation, it's where they find a healthy kidney and they donate it to the kidney patient into their abdomen. So getting a kidney transplant can be a long, drawn-out process depending on your medical history. If you have a long medical history, you're going to have a long evaluation process so that they can determine if you can successfully undergo this surgery. The surgery for the kidney is about 4 to 6 hours long, depending on the complexity. And there are some programs that will do a kidney transplant, Some programs can do a pancreas kidney, some can do a heart kidney. I mean, there's so many different combinations of the particular transplant list that you can get under. So depending on the qualifications and whatnot, you may be able to qualify for another organ along with getting a kidney transplant. But that's something you will know well in advance if you're able to do that. The pros and cons of the kidney transplant is that it's a long process. Oftentimes people have to wait years before a viable kidney is found. And sometimes that can be, very depressing, and they're having to take dialysis. Some people are having to work, do dialysis, do their transplant stuff all at the same time. And it can sometimes take a toll on people emotionally, just having to go through all of that. Another pro of transplant, as you can imagine, most kidney transplants are successful. There are times where it doesn't work and a patient has went through all that work, but I've known patients who've gotten more than one kidney, so it's just something that you have to decide if you want to deal with or not. Okay. But yeah, like I said, that's just a brief overview of the different treatment options that are available. We have in-center dialysis, which is the most popular option. We have home hemodialysis. We have peritoneal dialysis, which is a type of home dialysis. And then we have the kidney transplant. I've met patients who've actually done all the modality options, as they progress on their life journey through kidney disease. So just because you start one therapy doesn't mean you may not end up on another one. So you want to keep an open mind in regards to that. Okay. So if anyone has any questions or comments, please leave them below. If you have a suggestion for another type of video that you want to see me do, just let me know and I'll see if I can accommodate. And like I said, I really appreciate you guys watching, and thanks. Bye-bye.